Well, if you have diabetes, there is a community of support ready to help you at Hendrick Medical Center. And here to tell us more about it is Dr. Clayton Stevens. Thank you for joining us today. All right, tell us what you do at Hendrick.
So I'm an ophthalmologist there. I treat a variety of eye conditions, including diabetes, which is extremely common as it pertains to the eye. And our support group next Tuesday evening will be kind of diving into a lot more detail. But here today just to kind of give a brief overview of different ways, serious ways that diabetes can affect your eyes and vision.
And so people out there who either have diabetes, have a family member with diabetes, may not make the connection between an eye and having diabetes. So tell us really how it affects almost every part of your body.
So the biggest concern with our model here, in the back portion of the eye, there are numerous blood vessels that supply what's called the retina, this orange layer here in the model. The retina is what detects the image from the front part of your eye, and diabetes affects these blood vessels both in the eye and everywhere in the body. Can cause them to be leaky, both blood and fluid that can damage the retina in a way that it can't detect the image, which results in a blurred or poor image for the patient.
And how would someone out there with diabetes recognize these signs or symptoms, or are there any?
So the most common reason people come are changes in the vision acutely or abruptly. The good thing about diabetic screenings, which we recommend at least once a year in all diabetics, is that we can pick up subtle changes that may not be affecting your vision. And that's what we try to stress to people, that despite your vision seemingly being normal, it's still important to get your annual eye exam so we can prevent vision loss.
And so when you have diabetes, what really in that disease causes you to have these symptoms and causes your eye to do what it does?
Well, the main effect is the damage to the blood vessels and the damage that leaky blood vessels cause to the retina. Just like anything, the sooner you detect that and treat it, the less likely you're going to have permanent vision loss long term.
And so is there a way to prevent this if you do have diabetes?
The biggest way is working very closely with your primary care and or your endocrinologist to control it as best you can. And also being sure to keep a close check on other conditions such as high blood pressure. Diabetes and high blood pressure have a detrimental effect everywhere in the body, including the eyes. So just staying on top as best you can with your primary care team.
And so we did talk about the diabetes support group at Hendrick Medical Center. You are the speaker coming up next week. And so who are you inviting out to come and listen to what you have to say?
Certainly all patients with diabetes, family as well. It takes family support. It's a long chronic disease that requires many lifestyle changes that are very difficult for a person, and so family members or caretakers are certainly welcome as well as diabetics themselves.
All right, well, we appreciate you coming on our show today. I'm sure you are a busy man, so taking time to visit with us, we greatly appreciate it. If you would like to take part in the support group, they meet every first Tuesday. The next meeting will be at Hendrick Medical Center in the Shelton building on Tuesday, June 5th from 6 until 7 p.m. For more information, you can call 670-2421 or go to ehendrick.org.